Hi, I'm Penny Paul. I'm the Information and Connections Coordinator at the Summer Foundation, and I'm here with our new CEO, Luke Bosher. Hi, Luke.
Hi, Penny. Thanks for having me today.
Thanks so much for coming.
No worries. Well, I'm excited that we're here today to talk about a new resource that we've put together at Summer Foundation for young people in aged care. And that resource is really about understanding how the NDIS can help you pay for some types of aged care fees which people are currently paying for. So the resource that we've put together, it's called the ndis-and-aged-care-fees, a guide for NDIS participants, their families and supporters. And you can see the link up there on the screen to that resource. So that resource has all the information we're going to talk about today, and we thought that this would just be another helpful way to explain what's sometimes a complicated issue about residential aged care fees. So residential aged care fees are one of the things that the NDIS can pay for if you're a young person in aged care, but it's not the only thing. The NDIS can pay for some other things for you too. It can pay for things like equipment, and that could be aids that help you get around a bit more independently. They can pay for community access as part of your NDIS plan. That could help you leave the aged care facility, go into the community and catch up with family and friends. The NDIS can also fund support coordination, and so if you're keen to explore other options beyond aged care, a support coordinator can be funded by the NDIS to help you shop around and see what other kind of options are out there beyond aged care facilities. But certainly aged care fees are the thing that we're here to talk about today, and we are really pleased the NDIS is paying for these fees. We've been having a really long conversation over the last couple of years with government about paying for these fees because we've heard so many people get in touch with us who are under real financial hardship because of the aged care fees that they're paying. And so this is a great opportunity for people that are feeling under a lot of financial pressure because of their aged care fees to have some of that pressure taken away. So, Penny, can you talk us through what the NDIS will pay for when it comes to aged care fees? Do they pay for everything around aged care fees or just some?
No, there's 4 types of aged care fees, and the NDIS will provide contributions only to some of them and only up to certain caps and amounts.
So Penny, if you're a young person in aged care and you're paying some aged care fees, what should you do before you head into your NDIS planning meeting?
When you go into your NDIS planning meeting, I think even perhaps before that, it's important to ask for a face-to-face planning meeting, and it's important to do some pre-planning, and we've developed some sample NDIS plans to help you navigate your way through that and understand how NDIS funding is linked to your goals. But when you actually get a planning meeting, it's important that you take some paperwork to that planning meeting so your planner can work out the fees you're paying and which of those fees the NDIS will provide you with funding for. So you will have got 2 letters from the Department of Health when you went into aged care talking about the amount the government would pay and the amount that you're required to pay towards your aged care accommodation and care. So take those 2 letters, and also it's important to be aware of the subsidy or supplement that your room is eligible for. So that's like the date that your room was built or if it was refurbished. And so talk to your aged care provider about the subsidy and supplements that they're receiving for your room.
So this seems like a pretty complicated kind of area, Penny, around aged care fees, because we know there's all these different means tests and assets tests and different rules. So maybe we can take this kind of one part at a time. Mm-hmm. So you talked a bit about before you go into your planning meeting, you want to collect this paperwork. If we fast forward to after you get your NDIS plan, how is this going to work? Is the NDIS going to pay your aged care provider directly? Do they need to register as a provider if they're paying for the fees? Or do you need to get something else in your plan to help you pay for those fees?
No, so I think it's really important for you as a participant to understand and for the aged care provider to understand that they do not need to register as an aged care provider. In one sense, nothing changes for the aged care provider. They still get their funding from the Department of Health the way they always have. But if you're paying means-tested fees, you'll get plan management in your plan to help you administer those fees. And as a general rule, I would say in your planning meeting, you should ask for as much of your plan to be plan managed as you can. In fact, you can ask for every item to be plan managed, because if you're plan managed, you can work with your plan manager to employ whoever you like to deliver the services for you that are funded in your plan.
Cool. So you're going to come out of your planning meeting, and if you've got some fees paid for by the NDIS, it's your plan manager who's really going to help you through that and make those payments for you.
Yeah, and we've been working with some plan managers to build their skills in working out how to do this. So if you're unsure about who you should get to manage your plan, give us a call and we'll put up our details at the end of this.
Great. So let's get into the nuts and bolts of what the NDIS is going to pay for. Will the NDIS pay for everything that all those aged care fees that people are paying to their aged care provider?
No, there are basically 4 types of fees that people pay in aged care, and the NDIS will pay for some of them. And if you understand the logic of the NDIS, it'll become fairly obvious to you which of those fees they'll cover and which they won't. So there's a basic daily fee that people pay in aged care, and that's roughly $1,526 a month, and that's pegged at 85% of the pension, and it pays for things like food and heating and laundry in aged care. Now the NDIS considers those to be ordinary costs and it won't pay them, so you continue to pay them the way you always have. If you're paying a means-tested accommodation fee, there's a number of ways that you can pay that fee, and the NDIS will pay those fees up to a certain amount if you're paying them as a daily payment. But some people elect to pay those fees as a refundable lump sum, and the NDIS will not pay the fee if you pay it as a refundable lump sum, and you can remember that because it's refunded to you when you leave aged care.
Okay, so let me get this straight. So basic daily fee, the NDIS is not going to cover it because it covers your basic costs as if you were living anywhere in the community, but the daily accommodation fees that people might be paying, the NDIS can pay for them.
Up to certain caps, yep.
Great. Are there any other kinds of fees the NDIS will pay for?
So a care fee, a means-tested care fee, is something that NDIS participants might be paying. And yes, the NDIS will pay the full amount of those care fees. And they are subject to annual and lifetime caps, and the NDIS will work that out with the Department of Health.
Great. So it sounds like if you're paying a basic daily fee, you keep paying it and you don't get reimbursed. But if you're paying a daily accommodation payment or a means-tested care fee, then the NDIS will cover those.
That's right.
Great. And what do you think the rationale is for that? Why is the NDIS paying for those things?
Because the NDIS is a social insurance scheme, and if supports are reasonable and necessary for you, then they are bound to pay for those supports. So it makes sense that these are supports that you're receiving due to your disability, so they'll pay them.
Great. And if you're in aged care, will the NDIS pay for anything else that you might see in your NDIS plan?
Yeah, there's an amount that'll appear in your core supports. It's around $77,539 at the moment, and that is an amount which is basically showing the cost of your aged care place to the NDIS. Now, it's a very confusing amount and people don't understand why it's there or what to do with it. It's just showing that cost to the scheme. So you can't draw down on that amount. The aged care provider doesn't draw down on that amount. It's kind of, it's not a real amount in the way that all the other amounts in your plan are real and spendable amounts.
So if you get a plan from the NDIS and you're in aged care and it only has $77,000 in it, that sounds like a lot to me, but are you saying that it's actually not very much?
I'm saying it's nothing. So if that's all you've got in your plan, or you've got very little aside from that amount, I think you might want to seek the opinion of an advocate or a support coordinator, or get in touch with us and we can help you to figure out what went wrong and perhaps request a plan review, because that is not an amount that you can go out and purchase additional services to support your independence or your quality of life. That is just really making explicit the payment that the aged care provider is going to get, and they've always got it. So it's nothing, there's no new funding in that $77,000.
Okay, so if you come out of your NDIS planning meeting and you've got some funding in your plan for some means-tested care fees and the daily accommodation payment, can you just talk through again how you actually use that money to reimburse you for the costs of your aged care fees?
Okay, so if you're paying means-tested fees, you'll get funding for plan management, and so effectively your plan manager should help you administer these fees. There's some complications in here. One way to do this is that you just continue to pay all your fees in the way that you always have, and then your plan manager will reimburse into your bank account every month the amount of fees that you're entitled to have funded under the NDIS, and that's one way to go. Some plan managers might be able to work with your aged care provider to pay the fees directly to your provider, but there are some complications here because The NDIS will only pay for services already received, and many aged care providers bill in advance. So in that case, you're going to have to pay the amount and get reimbursed. But that's between you and your plan manager to figure out what's going to work best for you.
Great. Is there any other advice you'd have to someone that's in aged care and maybe paying some fees or has paid a refundable accommodation deposit? Anything else they should think about?
Yeah, so this does really open up some opportunities for some people who've paid a refundable accommodation contribution or deposit. And you need to perhaps get some financial advice, or if you're going into aged care, get some financial advice about which way you should approach this. On the face of it, you'd think, well, it's better to pay it as a daily fee because the NDIS will pay it. For some people, they might have some money, they might have $300,000 or $400,000, which is excluding them from being eligible for the disability support pension. They might want to think about actually paying the refundable deposit because they then have less assessable income and they'll increase their entitlement to a disability support pension. So it's really individual and you really need to think about it and get some advice. If you're thinking of swapping from paying a refundable sum and you want to convert that to a daily payment, bear in mind you have entered into a legal agreement with your aged care provider and you'll have to go into negotiations with them to change that agreement.
Okie doke. So what to from here? Where to from here?
Where to from here? Okay, so now that we've got your attention, I think it's download a resource, have a look at it. There's a checkbox on pages 10 and 11 that explain which fees are paid, which are not. It's a bit different for people who entered aged care prior to 2014, and we explain all that. There's other variables in here about, social leave and all of that sort of thing, and we go into that in the resource. That's why it's a long resource. We've also put together a shorter resource for your plan manager, and the details of that are on the screen, so you can provide that to them. And I think you should be considering how to get the most out of the NDIS, and that's why we've developed some sample plans. And if you want to think about perhaps leaving aged care, there's the Housing Hub and there's our NDIS housing resources to make sure you stay up to date with the sorts of things that the NDIS is doing for young people in aged care. Join our Consumer and Family Care Network and get in touch with us here at the Summer Foundation if you'd like some more information. That's info@summerfoundation.org.au, or you can call us on 03 9894 7006.
Fantastic. Thanks very much, Penny.
Thanks, Luke.